Greetings of peace, everyone. Assalamu alaikum. Today we will be discussing a very interesting topic on bridging the gap between systematic reviews and policy, presented by Dr. Hamofari Dimisani Mugwari. He's from Zimbabwe. He's a public health researcher, epidemiologist, and senior consultant with extensive experience leading HIV prevention initiative, digital health, implementation science, and strategic advisory work in Zimbabwe. His research has shaped national priorities and have contributed to multiple consultancies supporting ministries and global partners with planning and monitoring, evaluation, and integration. As a lecturer at the University of Zimbabwe, he has also mentored emerging professionals and support academic editing process, technical reports, manuscripts, and policy briefs. He is passionate about bridging research and practice, and he has actively contributed to regional networks focusing on sustainable, evidence-driven health systems. He's also an award winning of a Jeffrey Copeland Award for Excellence in Scientific Presentations in 2017, awarded at the FETP International Night, Centers for Disease Control and Prevention, Atlantica, USA. Presented Best Scientific Poster titled Hospital-Acquired Neonatal Sepsis in an Intensive Care Unit of a Central Hospital, Zimbabwe in 2016. Cohort study named in honor of Dr. Jeffrey Copeland, renowned former of the CDC Director and Global Health Champion. So this is just to recognize the outstanding presentation and scientific rigor of Dr. Hamofari, who is joining us today to present this very interesting topic about the gap between systematic reviews and policy implementation.
Thank you very much, Dr. Mona, for such an impressive introduction. I'll move on to the next slide. We've already appreciated the time, so I'll move on to slide number 2. So systematic reviews are the gold standard for evidence synthesis, offering clarity and reliability. Policy decisions, on the other hand, shape critical areas like health and education. Yet, despite the value of systematic reviews, they often fail to influence policy. So the question here is why? Because the way evidence is packaged and communicated doesn't always meet policymakers' needs. So today we explore this gap and come up with some practical suggestions of what solutions we can get. Let's move on to slide number 3. So I thought I would start off from introducing both systematic reviews as well as policy. A systematic review is more than just a summary of studies. It's a rigorous process designed to minimize bias and provide reliable evidence. It involves defining a clear person, searching multiple sources, screening studies, and synthesizing findings. This structured approach makes systematic reviews the gold standard for evidence-based practice. Next slide. Policy development. Next slide. So policy development is not a single event, it's a cycle. Evidence plays a role at every stage, from defining the problem to evaluating outcomes. Systematic reviews are particularly valuable during formulation or in formats that policymakers can't easily use. Understanding this cycle helps us identify where the two can be integrated and made to have the maximum impact. Let's move on to the next slide. Let's move on to the next slide. So this is where I was actually defining systematic reviews as structured and comprehensive synthesis of evidence research. We can move on to the next slide. So on slide number 5, the gap between research and policy is not just academic, it has real-world consequences. Research often moves slowly, while policy decisions need quick, actionable insights. Add to that challenge of technical language and limited capacity among policymakers, and you have a disconnect that undermines evidence-informed governance. Our goal is to identify strategies that can bridge this particular gap. Let's move on to slide number 6. Bridging the gap requires deliberate strategies. Frameworks like the grade, that is a framework for synthesizing research. Please move on to the next slide. These help to translate. So I've enumerated two tools here, the grade as well as the ETD, which is evidence frameworks that are designed to translate evidence into actionable recommendations. Policy briefs and infographics make findings digestible, engaging policymakers early, ensures research meets their needs. Capacity building empowers decision makers to use evidence effectively. And when time is short, find that the usual result is rapid reviews so that they can provide timely insights. Next slide. So challenges are inevitable. Uh, there is technical complexity, political priorities, and resource constraints, which often stand in the way of evidence-informed policy. But solutions exist. I suggested co-production, which ensures relevance, rapid reviews to meet agent needs, and evidence champions, which can advocate for integration. And lastly, localization of evidence, which can make global findings meaningful to that particular local effort. Let's move on to the next slide. So I hope that the suggestions that I proffered in the previous slide can actually help. But I want to bring in the context of MRIN here, where MRIN plays a critical role in bridging the gap between research and policy. As I listened and followed through the abstract that have been presented, I actually saw that there is a real opportunity to make a difference through this particular network. And things like capacity building, policy dialogues, and collaborative platforms like the one which we are having now, we can ensure that evidence not just produced, but it's also used. Our rapid evidence services help policymakers make informed decisions and even under tight timelines. Ultimately, our goal should be to embed evidence into DNA of policy. Uh, Moved a bit faster, but it's okay. When we look at the slide number 9, uh, I want to emphasize on how, if we can take one thing away from today, it should be that systematic reviews are essential, but they only make an impact when they are translated into actionable policy. Let's keep this at the back of our minds as we go on to do the studies that we were highlighting here, that bridging the gap requires collaboration, communication, and capacity building. And I actually observed that MRN is actually supporting this process to ensure that the evidence that we generate can actually inform the decisions that we get in our respective settings. So in my last slide, I want to thank you for your attention and engagement. And I would really love to hear from you, your thoughts, your questions, and your experiences. How do you see systematic reviews in policy in your context, and what challenges you have faced beyond what I just emphasized in this presentation, and what solutions actually worked for you? I'll then open the floor through you, the chair, to get other people's views on this particular subject. Over.
Thank you so much, Dr. Hamo Ferry, for this very insightful presentation. It's actually very good that we discussed this after reviewing the abstracts, and it's certainly thought-provoking. How can we take it forward to be implemented on a policy level? So now the floor is open for any of our participants who can reflect on what has been just presented, or even enrich the discussion on how can we take it forward for policymakers. What was the motive behind it? Yeah.
It's an observation, Mona. I've often observed that systematic reviews provide very valuable information, which we expect that because this is the highest level in terms of research methodology, where we are synthesizing what other people have observed. This should be the basis to inform the policy as well as practice. But there seems to be this disconnect where the systematic reviews do not find their way into the policies as well as practice. And this disconnect is what really prompted me to want to interrogate. That's why I then highlighted the things like the length of time that the systematic reviews take, and at times the way the information is package is then not palatable for policymakers to be able to utilize them or even to understand. And sometimes they then resort to some rapid reviews, etc. So I believe that there is an opportunity where we can try to ensure that systematic reviews can really find their rightful place in terms of informing policy and practice. But how we can be able to do that is what I'm hoping that we could be able to explore further beyond the suggestions that I made during this of
Yeah, and it came to my mind ultra processed food and the many articles published on the hazards on health and how it really affects not just the physical health but also the mental health. And up till now, there is no political will to to oversee this kind of food industry or put any legislations or anything. Next month we will also have this opportunity to discuss another topic within the journal club. So feel free, everyone, to just write directly to me or even send us an email if you have any idea about an article that can be discussed within the group, and then we can take it forward for discussion the month after that. So thank you everyone for joining this meeting. It has been really such an informative one, and we really appreciate your attendance. And any final thoughts before we end this call?
thank you, Mona. Thank you so much for the patience. Thank you, everyone, for participating.
Thank you very much, Dr. Hamoferi.
Yeah, thank you so much. Thank you, all of you, and especially Professor Mona. Thank you very much for organizing this team since 2022. Yeah, just I was sometimes come in and out due to my busy schedules, and I really appreciate your precious time and effort in organizing this team. Thank you very much.
Thank you, and likewise, Kajilja. We are here because of the supportive team and the spirit that we are having for the mission of the MRN. You know, we are here with a purpose. So let us continue working hard with our abstracts and supporting one another and learning together along the journey. Thank you so much, and see you, inshallah, in next month. And we will be communicating through email and WhatsApp. So until then, take great care of you, and bye for now.
Thank you so much, Prof. Thank you.
Bye bye. Thank you.